Welcome to MI Hospice and Palliative Care, where we provide our services in the greater Los Angeles, San Fernando, and Orange County areas.
We are on-call nurses 24/7. Whether you call us at 3 a.m. or 3 p.m., we are there for you.
Hi, my name is Odette Nairouz. I used to be the owner of Shepherd Home Health, and I passed the business to my girls, but I'm still involved. Just want to make sure the patient got the right service.
Hi, my name is Stephanie Solomon, and I'm the Vice President of MI Hospice and Palliative Care.
My name is Jennifer Solomon, and I am the CEO of MI Hospice and Palliative Care.
My name is Dan Murray, and I am the Chaplain and Bereavement Coordinator for MI Hospice and Palliative Care.
My name is Stephanie, and I am the social worker with MI Hospice and Palliative Care.
My name is Vanessa, and I am a hospice registered nurse.
My name is Jessica O'Brien, and I am a hospice registered nurse.
People tend to think that once they're on hospice, they are going to die, and that's not necessarily always the case. About 20% of our patients sometimes end up being discharged home because we monitor them so closely that they actually show improvement. And whether the diagnosis is stroke, Alzheimer's, cancer, end-stage Parkinson's, congestive heart failure, we take care of all those patients that qualify for hospice.
Continuous care is the service provided within hospice that allows us as nurses to stay at the bedside for 24 hours during any emergency situations so that we can manage any uncontrolled symptoms so that the patient does not have to go back and forth from the hospital and they can stay in their home.
Hospice really benefits patients and families because we're there to walk with them in a very difficult time when their loved one is terminally ill, and it's just keeping them comfortable and support them. In the days past, they might have been in a hospital or been at home alone.
Being a hospice nurse has allowed me to see its ups and downs in life, but allowed me to be empathetic to all situations.
The primary goal of the social worker is to build rapport with the patient and the families in order to gain their trusting relationships during a difficult time. The social worker also plays an important role in providing thorough education and psychosocial support in order to decrease anxiety from the patient and their families, and also provide a listening ear, especially when patients and families do have concerns or want to express fear.
Walking the journey with them, providing care at their home and for the families as well, and for as much as necessary. We can be there as much as they need, 24 hours a day, just to support them. And it just helps them cope and accept better with the situation with their loved one. And we're there to help and support them.
When you have two choices, optimal quality of care or standard care, here at MI Hospice, we choose optimal quality of care for our terminally ill patients. We provide dignity, comfort, and peace to those who are suffering from a serious condition.
Well, first of all, we were caught off guard with the fact that my dad apparently needed hospice. It was recommended and suggested to us, and I guess we were sort of my wife too, in a state of denial about just what his situation and condition was. So we were at the hospital literally in the parking lot when we had called MI to see what type of services they could provide. And Pastor Dan showed up on site to kind of initiate the services. My dad had been in the hospital for a couple of days, basically semi-conscious. And we were going to have to go up and deal with the administrative paperwork. We were going to have to arrange for transportation. We were going to have to arrange for care for him and things. And basically MI with Pastor Dan stepped in and said, you know what, we'll take care of everything. We're going to provide transportation. We're going to provide services. We're going to get him back into this facility and make him comfortable. Just concentrate on the situation at hand and not have to worry about all the paperwork and other bureaucratic nightmares that you might have to face. So it was very comforting to have Pastor Dan and MI show up. Once they got him back to the facility, they arranged 24/7 nursing for my dad and cared for him very intensely. My mother actually was in the same room, and they were comforting to her as well. I was there just prior to my dad passing, and had left briefly, but I know that when he passed, he was at ease and at comfort, at peace with himself. And I'm sure part of that was MI's services and comforting care that they were giving him prior to his passing. So I was very thankful and comforted by Pastor Dan, the nurses, and MI's presence. And then as a follow-up, my mother also lived in the assisted living facility where my dad passed. And MI, Pastor Dan, would stop by and follow up bereavement services and talk with her and just sit with her and visit. And as troubled as my mother sometimes was, she really enjoyed those visits and was really at ease, and we were happy with that.
I am Caroline and provider of my mom, and actually with one of my friends, close friends, I familiar with the hospice work. The story started when I needed, and I had difficulties with the taking shower of my mom, and my friend suggested that why you don't use of the hospice help. So when I looking and saw that MI Hospice is one of the best that I could find, and the important things when I started work with this hospice and this organization, I saw when I'm calling and I need them, they are rapidly and very quickly, they can help me and they are with me right away. And I'm so happy about that. It's a good help that give me energy, and this energy, it makes trust and comfortable with my job, that the reflection of that work is going to my friends and my family and people that are around of me, and I can look and pay attention to my mom better with more trust and comfortable life.